85% of diabetics routinely poison themselves every morning without even knowing it. The hidden secret about seemingly harmless habits is the real culprit behind skyrocketing blood sugar and complications that arrive faster than you can imagine. Keep up your old habits if you want your condition to become even more serious. Based on clear scientific research, I'll expose the 5 most dangerous morning habits that diabetics absolutely must avoid. And I'll bet, at least one of these habits you're doing every single morning. These simple changes can help you better control blood sugar and reduce medication dependence starting today. Don't miss this video before it's too late. 1. Waking up early and exercising on an empty stomach, the healthy habit silently destroying your body. Are you waking up with an empty stomach and thinking you'll immediately exercise to stay healthy, believing you're living well when you're actually destroying your health? Diabetics, especially type 2, have poor blood sugar regulation due to the body not producing enough insulin or using insulin inefficiently. In the morning, the dawn phenomenon can occur, causing blood sugar to suddenly spike as the body releases hormones, cortisol, glucagon, to wake you up. When you exercise on an empty stomach, your body is forced to burn blood glucose to create energy, causing a sudden blood sugar drop. The serious consequences if you maintain this habit: acute hypoglycemia, causing dizziness, hand tremors, cold sweats, and potentially even fainting. But it doesn't stop there. If you exercise when it's still cold, with blood vessels constricting, you're activating risks of cardiovascular events, stroke, and brain vessel rupture without even realizing it. A study published in Diabetes Care, American Diabetes Association, reveals that exercising on an empty stomach increases hypoglycemia risk, especially for diabetic patients using insulin or insulin-stimulating medications. Furthermore, according to the American Heart Association, AHA, older adults should avoid outdoor exercise too early when it's cold to reduce the risk of blood vessel constriction and brain vascular accidents. I understand that right now, you might feel alarmed, not expecting that this seemingly good exercise habit could hide so many risks. But don't worry, you can absolutely adjust and rebuild a safer, more effective exercise routine without too much complexity. First and foremost, I strongly advise you, absolutely do not exercise on an empty stomach. Your body needs a stable energy source to prevent hypoglycemia. Just a slice of whole grain bread, a few almonds, or half a banana is enough to fuel your body. When you first wake up, immediately drink a warm glass of water, not just to hydrate but also to awaken your circulatory system and support metabolic processes. During winter, when outdoor temperatures are very low, don't rush outside when it's still cold. Wait until around 6:30 to 7 a.m., when the sun is up and temperatures are more stable, before starting your physical activity. And finally, don't forget to warm up thoroughly, especially if you're over 50 or have a cardiovascular history, because sometimes just one moment of carelessness can lead to unforeseeable consequences. I'm certain this is a habit so common that almost everyone falls into it. Some even think it's a way to save time or lose weight quickly. But the truth is completely opposite. It silently destroys metabolic processes, loses blood sugar control, and pushes diabetics into a spiral of complications. But you can improve this habit right away today, following my insights. Keep watching to learn about habit number 2, coming up next. 2. Not drinking enough water after waking up, a small habit silently destroying the diabetic body. You might not realize, but after 7 to 8 hours of sleep, your body has fallen into a severe state of dehydration. While you're sleeping, your body continuously loses water through breath and sweat glands. When you wake up without immediately replenishing water, your blood becomes thicker, circulates more slowly, and creates the perfect condition for uncontrolled blood sugar spikes. Diabetics already have compromised circulatory systems and blood vessels, so dehydration further increases the risk of blood clotting, leading to cardiovascular complications, kidney damage, and increased stroke risk. A study published in Annals of Nutrition and Metabolism shows that even mild dehydration can cause glucose levels to rise in type 2 diabetics, as the vasopressin hormone is released more to retain water, inadvertently increasing glucose production in the liver. This means if you don't provide sufficient water immediately after waking, your body will self-rescue by raising blood sugar. I'll show you how to change this simple yet extremely important habit. Immediately after waking, the first thing you should do is drink a warm glass of water. Nothing fancy, just 300 to 500 milliliters of warm filtered water is enough to awaken your body, activate circulation, make blood thinner, and regulate blood sugar. If you take diabetes medication in the morning, drinking enough water also helps reduce pressure on the liver and kidneys and supports more effective medication absorption. Don't wait until you feel thirsty, by then, your body is already in a red alert state. Create a habit of drinking water the moment you open your eyes, even keeping a water bottle by your bedside as a reminder. I know you might find it difficult to change your habits immediately, but sometimes a simple action like morning water consumption can make a significant difference for a diabetic's health. You can set daily reminders to maintain a more consistent routine. Another equally common habit with consequences more dangerous than you might imagine is coming up next. I'll continue analyzing habit number 3 for you. 3. Not checking morning blood sugar. Skipping this daily, you'll pay the price with your health. You cannot control what you do not measure. This is a fundamental principle for diabetics. Yet many people skip morning blood sugar checks, thinking feeling normal is sufficient. But did you know the time immediately after waking is extremely sensitive for diabetics? While you sleep, your body continues working silently. And in the early morning, the dawn phenomenon can occur, a time when the body releases multiple hormones like cortisol, adrenaline, and glucagon, to wake you up, inadvertently causing abnormal blood sugar increases that you cannot detect through ordinary sensations. If you don't check blood sugar immediately upon waking, you'll never know if your body is falling into a dangerous condition. Consequently, you'll make wrong decisions throughout the day, uncontrolled eating, exercising at the wrong time, taking inappropriate medication. A study published in Diabetes Technology and Therapeutics reveals the dawn phenomenon affects up to 54% of type 2 diabetics and over 75% of type 1 diabetics, causing sudden morning blood sugar spikes, even when all indicators were within normal limits the previous night. I recommend creating a habit of checking blood sugar immediately after waking. This is the golden moment to know your exact blood glucose level and make appropriate adjustments for the entire day. If morning blood sugar levels are high, you can adjust by reducing carbohydrates in breakfast, increasing fiber and protein, or modifying medication timing according to your doctor's guidance. I believe proactively controlling morning blood sugar is about protecting your body daily. Use measurement tools to know precisely about your body instead of guessing by feeling. Next, I'll help you improve habits by alerting you to habit number 4 that many of you are likely practicing. 4. Skipping breakfast, a small mistake with extremely dangerous consequences for diabetics. You might think skipping breakfast helps you feel lighter, lose weight, or save time. For normal people, that's already a bad choice. But for diabetics, it's a seriously harmful habit. When you skip breakfast, your body lacks energy after a long night. It's forced to produce hormones like cortisol and glucagon, substances that cause the liver to release glucose into the bloodstream to maintain energy. The result is abnormally high blood sugar in the morning, even before you've eaten anything. Moreover, the pancreas, the organ producing insulin, the hormone that moves glucose from blood into cells, is also affected. The pancreas contains beta cells, which play a crucial role in insulin production. When you skip breakfast, these cells remain inactive until lunch. This delays insulin response, causing blood sugar to spike after lunch and remain difficult to control throughout the entire day. A study from the American Journal of Clinical Nutrition found that people who skip breakfast have 28 to 36% higher post-meal blood sugar levels compared to those who eat a complete breakfast, even when consuming the same total amount of food throughout the day. Some people even skip eating while still taking blood sugar medication, which is extremely dangerous. Without food, medication can cause sudden blood sugar drops, dizziness, sweating, trembling, and potentially fainting if not addressed immediately. You can absolutely correct this mistake with a proper breakfast. The first and most important principle, never skip breakfast. No matter how busy you are, take a few minutes to fuel your body with a simple but nutritious meal. You could choose a slice of whole grain bread with boiled eggs, or unsweetened milk with apple slices. Adding a few nuts like almonds or walnuts is an excellent way to stabilize blood sugar and create a longer-lasting feeling of fullness. And if you think just eating breakfast is enough, be careful. There's another seemingly harmless habit that many diabetics practice each morning, which might be silently undermining all your blood sugar control efforts. Let's explore habit number 5 right away. 5. Eating breakfast wrong and drinking coffee on an empty stomach, a habit that seems good but harms health. Many people think, just eating breakfast is enough, but the truth is eating incorrectly can be just as harmful as skipping breakfast. Foods like sweet pastries, white bread, plain rice porridge, or packaged cereals with high sugar content are rapidly absorbed carbohydrates that quickly raise blood sugar. They might taste good momentarily, but shortly after, blood sugar will drop rapidly, leaving you tired, sluggish, and depleted. For diabetics, these erratic blood sugar fluctuations force the pancreas to work harder, making it more vulnerable to damage over time. Long-term, this reduces blood sugar control ability and increases complication risks. Another mistake is drinking coffee on an empty stomach. You might think coffee helps you wake up, but consuming caffeine without food triggers stress hormones like cortisol. These hormones can raise blood sugar without you realizing it. A study published in Diabetes Care, American Diabetes Association, suggests that drinking coffee before breakfast reduces insulin sensitivity by 15% and significantly increases post-meal blood sugar in diabetics. To maintain a healthy breakfast routine, choose slow-absorption foods. These are items that don't cause sudden blood sugar spikes, helping your body remain stable throughout the morning. Examples include whole grain bread, oatmeal, boiled eggs, steamed vegetables, or nuts like almonds and walnuts. If you're someone who drinks coffee every morning, remember to eat something light first, then have your coffee. Ideally, choose black coffee without sugar, condensed milk, or fatty cream. This approach prevents blood sugar spikes, reduces pancreatic stress, and helps prevent future complications. Morning is the golden time for diabetics to control their health. Just by starting your day correctly, your body will be more stable, blood sugar better controlled, and complication risk significantly reduced. Don't underestimate small actions, they're what create significant differences in your daily health journey. If you found this video helpful, don't forget to follow upcoming videos on our channel. We have many practical, easy to understand, and immediately applicable insights to help you live healthily and manage diabetes more effectively every day. See you soon.